In 1981, my mom was diagnosed with breast cancer and underwent a modified radical mastectomy along with an axillary lymph node dissection. Unfortunately, they removed too many lymph nodes and went too deep, and she ended up with permanent nerve damage. She was on narcotics and pain medication, became addicted to them, and ended up spending a summer in Johns Hopkins going through withdrawal. She was also never told to move her arm after surgery. As a result, she had a frozen shoulder. She was unable to raise her arm through the proper range of motion and had to go through painful physical therapy for several months. Then in 1996, she was diagnosed with breast cancer again on the other side. Now, the first time around, because of the nerve damage, she did not undergo reconstruction. So after 15 years of not feeling like a full, complete woman, she wanted to go ahead and get breast reconstruction on both breasts. She decided to have what's called an abdominal tram reconstruction, where they actually take your rectus abdominis, which is the main muscle in your stomach, to create the breast, and they tunnel it up through the torso to reconstruct the breast. Well, what that does is it compromises your core musculature, and she already had issues with her back, unbeknownst to her at the time, that was going to set her up for future degeneration. And this is something that I feel should have been given consideration before they even chose this surgery, but we'll get back to that later. So she goes ahead, has another modified radical mastectomy, this time undergoes the abdominal tram reconstruction to the side with the nerve damage, and has an implant on the other side. Roll forward, she has 10 years later chronic pain as a result of the implant, constant staph infections, and has to have the implant taken out. Well, during the course of all of these events, she asked me as a personal trainer if I would work with her to help her in rehab, particularly after the second time. She really felt helpless and that nobody was educating her. And going back to 1996, when I started looking for information, there was virtually nothing out there at the time. So I worked with her breast surgeon along with the chiefs of breast surgery at Georgetown, Johns Hopkins, and George Washington University to develop a protocol for breast cancer survivors, and it was Essential Exercises for Breast Cancer Survivors, the book, which was published in 2000. So we spent 3 years putting together a 4-level progressive resistance program, the first of its kind. And here we are in 2012 doing a video of just that. To this date, it is still the only progressive resistance program available. As a trainer, what I came to find out was that there were certain muscle imbalances and range of motion deviations that were the direct result of surgery and treatment. In my mom's case, she was fortunate she did not have to undergo radiation or chemotherapy, which have their own batch of side effects that we'll talk about later. But she did encounter muscle imbalances and limitations in the affected arm. And when I say affected arm, it is the arm that had the axillary nodes removed or the side of surgery. So I'll refer to that throughout the video. There's something known as lymphedema, and it is the swelling of the affected limb, or it can even be that side of the body, where either radiation was given or lymph nodes were removed. So in the case where my mother had clusters of lymph nodes removed in her left armpit, she was then at risk for lymphedema. And lymphedema is irreversible if it goes too far. So if it's caught early, it can still be managed and reversed. And better yet, how about preventing it? By educating breast cancer patients and survivors on what lymphedema is and how to prevent it. Unfortunately, 25 years later, and no one had still told her about lymphedema. We are going to talk in abundance about lymphedema during the course of this video and educate you on how to prevent it, how to identify it, and then how to manage it if you do encounter some of the side effects. So let's begin with an at-home assessment. Now, most of us don't have the luxury of a personal trainer. However, we do have a directory of cancer exercise specialists who have gone through our training, and they are listed on our website if you are in a position to work with someone. If not, if you'll just follow my simple directions and don't leave anything out. It is critical that you identify the areas of need, and those are the things that you need to work on, that need to be addressed. One of the most important things is that you achieve as close to full range of motion as possible before you begin using a weight or a band or any type of resistance. For example, if I can't even bring my arm up barely above shoulder height, but the normal range of motion should be straight up and down, and I add a weight and I continue to go through the range of motion only for about 90 degrees, then what's going to happen is I will only be strong in this first 90 degrees of motion. I will never get my full range of motion back. So as we begin and we go through level 1, it's going to be focusing on range of motion and correcting postural deviations. So what you need to do at home is identify which of those things you need to work on. So looking in the mirror, what I'd like you to do is just march in place. You can even close your eyes. Of course, you won't be looking in the mirror. And stop and stand naturally. Don't try and stand erect. Just do whatever feels comfortable to you. And just take a look at yourself. Is one shoulder higher than the other? Is your head tilted in one direction? Just make mental notes. Look at your hands. Now, if your palms are facing backwards, that is an indicator that you have what we call round shoulder syndrome, also known as upper cross syndrome. Very common following radiation and or mastectomy and reconstruction. As these muscles tighten and shorten, or it becomes bound down by scar tissue, the tendency is for things to pull inward. And on the contrast, you have your back muscles becoming weak and overstretched. So the last thing you want to do is do anything that involves a pushing motion forward, as that will only continue to exacerbate those shortened muscles. We're going to want to focus on stretching the chest and strengthening the back. And the series of exercises to follow will have that as the emphasis. So even if you love doing bench presses and you believe you're doing the right thing, hear me out. You are not. Do this in the order that we're suggesting. It's been proven. We've done this for years and years and years with great results, and you will end up having a safer and more effective outcome. So stretch the chest, strengthen the back. Another thing that's going to be a little difficult for you to see yourself is if you stand and you look in the mirror, obviously you're going to have to turn your head, but try and gauge whether your head is forward. Do you feel that your head is like a bowling ball on the end of a fishing rod? Think about this. For every inch your head is forward out of the normal, for example, it's supposed to be your ears should be lined up right over your shoulders in the middle of your clavicle. So for every inch your head goes forward, it's the equivalent of 10 pounds on your cervical vertebrae. So if your neck is hurting you, that could be the reason why. So if you find that your head is forward, what I want you to start thinking about is bringing your head back in alignment. From the side, it's basically like a chicken. And you're just going to bring your head back in. Now this is not tilting your chin down to your chest, nor is it tilting backward, but just as if you were walking into a wall. Hold it for a couple seconds and then relax. Bring it back, hold it, and relax. Now if you have high blood pressure, it's critical that you do not hold your breath, as that will elevate your blood pressure even more. So for those of you who may have high blood pressure, just hold it for a second. If you don't have high blood pressure, then you can hold it for 3 to 5 seconds. And you can start with 3, 4, 5 repetitions. Make sure that you don't have any neck pain, or sometimes it may even trigger a headache or a migraine. So start and progress slowly. I can't emphasize that enough. It doesn't matter what you were doing prior to your surgery and treatment. It doesn't matter if you're Lance Armstrong or Peggy Fleming. You're going to start at the beginning. And I assure you, if you do things in the proper order and take precautions, you will get back to that person you were before cancer, maybe even better. So we've addressed the forward head, the rounded shoulders. Now let's take, for example, somebody who had an abdominal tram, like my mom. Right after surgery, she has an incision from one hip to the other, huge incision, and she was doubled over, could barely stand up straight. So for the first couple weeks, maybe even a month after surgery, she's going to be hunched over, flexed forward, that head is leaning forward, because it hurts to stand up straight. Well, keep in mind, she doesn't have that muscle there anymore. So several months later, we go from being hunched over to being what we call lordotic, or having that lower curvature of the spine, sway back. And now all the pressure is on the lower spine. If you've had an abdominal tram and you're experiencing low back pain, this is probably why. You don't have the strength in your core and your back is overcompensating. So we need to work on your abdominal muscles. Now, I don't suggest doing crunches or any type of sit-up type exercises because you're missing half of your muscles. So if you're doing a crunch, conceivably, you're working half of your abs, and then, I know this sounds ridiculous, but the other half is in your breast. And those muscles don't know any different. The brain is still telling them to contract. So when you do a crunch, you're going to feel a contraction here and here. It doesn't make any sense. So we will do exercises on the exercise balls, on the balance discs, on the foam roller, and we'll work from the inside out to strengthen those core muscles. And at the same time, we're going to stretch out and strengthen the lower back muscles. So you are looking at your head, you're looking at your shoulders, and then if you've had that abdominal tram, you may be more aware of your positioning changing in your lower body. But even if you haven't had an abdominal tram and you still are lordotic and you find that your hips are tilting forward, this is going to apply to you. Now, one other reconstructive surgery that I need to address is if you've had a lat flap, and that's where they take the latissimus muscle and reconstruct the breast. And it's done in much the same way in that they tunnel that latissimus through and out the mastectomy scar, but now you're dealing with one of the largest muscles in the back. And so the stability of your shoulder may be sacrificed, which will also result in perhaps an exacerbated round shoulder syndrome, even more so, because not only do you have the perhaps scar tissue from radiation, scar tissue from surgery, maybe even adhesions, but now you have this additional surgery. And it's a little misleading because right after surgery, if you look at yourself sideways, you might be standing perfectly straight and in fact have better posture than you've ever had because you have an incision here and you have an incision here. So they're both countering one another. But eventually what's going to happen is this is going to give way to weakness because that muscle's not there anymore. And that's when you're going to see that shoulder round forward. So first we're going to address the postural deviations, but then the next thing we need to talk about is range of motion. And I touched on that a little bit earlier in that if we don't have desirable range of motion, the last thing you want to do is add what we call a load, which could come in the form of a weight or a band or any applied resistance that's going to essentially strengthen the muscles. And we want to strengthen them through the full range of motion. So once again, look in your mirror, try and stand as still and normal as possible, and let's begin with your affected arm. So that is the side that you had surgery. Now, if you've had surgery on both sides, just pick one because we're going to do both of them. It's really critical that you picture that you have two panes of glass. So in other words, as you're raising your arm, you've got a pane of glass on either side, and you can't move out of that pane of glass as that changes the normal pattern of movement. So with your thumb pointing to the ceiling, pull your belly button towards your spine so you're standing tall. Raise that arm up as high as you can without pain. Now, if you get to this point and you start to feel pain, then that's where you stop. So make a mental note that you raise your arm 2 inches above your head. Or, of course, I don't have a mirror in front of me, so I can't really gauge how high it is, but just make a mental note of where that's at. And in fact, if you're feeling strong enough to hold the arm there, hold it there. And take the other arm up. Same thing, you've got those two panes of glass. Now let's say this is my unaffected arm, and I can go all the way to 180 degrees. Well, then technically we're going to assume this is my norm. I am capable of moving 180 degrees. So that's going to be my goal now with the affected side. And this movement is known as flexion. So what do you do throughout the day that involves flexion? Well, if you have to reach into a cabinet or a cupboard to get a coffee cup, guess what? If you can't reach your arm up there, it's going to start affecting your activities of daily living. And it may not seem like a big deal until you need to do something that you have to reach up high. So identify which arm has or doesn't have complete range of motion, and then make a mental note or write it down. I need to work on flexion. The next thing we're going to focus on is called abduction, like abduct, to move away from your body. And you may even want to do this, if you can, standing against a wall, but you may not have a wall that faces a mirror. So once again, I'm going to have my arm by my side, but this time instead of my thumb going forward, it's going to go out to the side. and I'm standing up nice and tall. I've got 2 panes of glass, so I can't come forward and I can't move backward. And I'm going to raise my arm all the way up. And I know I'm looking at my arm while I do it, but don't when you do it. You want to look straight ahead, because as soon as you look at your arm, you're going to change the range of motion. So go up as high as you can with no pain. Make a note, look in the mirror, how high are you raising that arm? Is your head tilting to compensate? Because if it is, then you're going to start over. You don't want any head or neck movements. And then take the unaffected side, do the same thing. And if this arm is going up considerably higher, then that's essentially your norm for the affected side. But if they're both the same, then you can say to yourself, well, there probably weren't any negative effects from the surgery or treatment. And we're still going to work on both of the arms because we want to get full range of motion, but it's not a result of the surgery or treatment. And our norm will be a little lower than if one were higher than the other. So abduction, what do you do throughout the day that may involve having to use your arm reaching out to the side? You ask yourself that, and how important is it to you to have that full range of motion? The next one is extension. Now let me tell you, if you can't do shoulder extension and you have an itch on your back, you're in trouble, because you will not be able to scratch it. And it doesn't seem like a big deal now, but when you try to scratch your back, or you try and take off your bra or put on your clothes, whatever, and you can't do it, you realize just how many activities of daily living are affected by this limited range of motion. So extension, you want to look straight forward. And the biggest mistakes people make is that they bring their head forward or they hike their shoulder up. So make sure keeping your shoulder down, body erect, head in alignment, that you're going to raise that arm up as high as you can, but not elevating the shoulder, not letting the head go forward. And so, of course, I did my unaffected side first, so this will be considered my norm. And then I'll do my other side. And let's say it's significantly lower. Think about this. If I've got tightness across my chest from a mastectomy, from radiation, of course it's going to be difficult to raise my arm back, because I'm pulling against that scar tissue and it hurts. And so when you think about all of these planes of motion that are affected, it makes sense when you think about being bound down by these incisions and the ensuing scar tissue or adhesion. So if you've got limited extension, then our focus is going to be, once again, to stretch the chest, but also to strengthen the back. So the postural deviations and the range of motion limitations all kind of go together, and the exercises will complement each other. Lastly, we have what's known as external and internal rotation. So to externally rotate your shoulder can look like this, or if your arm were by the side, it would look like this. Internal rotation, on the other hand, would be going inward, or if your arm were up here, it would be going downward. Now, internal rotation is the one that's probably the least affected, because you're going in the direction of the scar tissue, with one exception. If you've had a lat flap and you've got the scar tissue back there as well, or it's just painful, and you try and go in the opposite direction, you're going to feel that limitation. But external rotation, you'll be able to visualize, once again, with that round shoulder syndrome, forward head tightness through here, and you try and rotate backward, you're going to feel the limitation. Now, some of you may have perfect range of motion on both arms, while others feel very self-defeated when you compare one side to the other. It's really individual, and know this, wherever you are today, you will improve. I can't guarantee you how much, because it depends what was your fitness level before, what are your genetics, how often are you going to work out, what is your pain threshold. All of these things will come together and help you to decide for yourself how hard you have to push. So now that you've done your assessment, you have a little bit of an idea what your range of motion limitations may be, what postural deviations you're dealing with. We're going to move on to level 1. And level 1 is going to be all about range of motion and correcting postural deviations. We're not ready to use weight yet. You need to be at least 6 weeks post-op, or at the very least, make sure you have permission from your doctor to begin this or any other exercise program. Let's get started. So this is level 1 of essential exercises for breast cancer survivors. This is for people who are just out of surgery. And when I say just out of surgery, you're still 6 weeks out with the permission of your doctor. And if they make an exception to the 6 weeks, that's between you and them. But that's the general rule of thumb. So we have Leanie here. Hi, Leanie. Thanks for being here today. And so you're 6 weeks out now. We're assuming everything is fine. We've got the medical clearance and you are ready to go. Now, I don't know if you heard me talk earlier about lymphedema. So your left arm is the affected side. And after having lymph nodes removed, that puts you at risk for swelling in the arm, well, I was going to say in the chest, but I'll explain that, and all the way down into the hand and fingers. Now, when I was referring to the chest, you also had radiation to the chest wall. So you have a double risk. So statistically, with an axillary lymph node dissection, you have about a 16% chance of getting lymphedema, but that doubles with the radiation also. So it's really important not for you to worry about it, but to be aware of it. Now, one of the things that we did when we did the assessment is I took your baseline measurement. So for those people who are watching, if they've not taken their measurements, it's no big deal. Don't worry about it. But I want to teach you about pitting edema. So typically, if I take my thumb and I press down and I push my finger into my arm, you'll see that it basically blanches and then it refills immediately. Now, if somebody has lymphedema, what you see is that it blanches and it doesn't refill with blood that quickly. So it actually holds the indentation. It's like silly putty. So as we go through and one day to the next, I'm going to have you look for signs of swelling at various places along your arm, because remember, it could be in your hand, forearm, all the way up in the arm. And if you notice yourself or anyone at home that you have any indication of swelling, you need to go to the doctor right away. Don't wait, don't mess around, because if it's stage 1, it's still potentially reversible. Once it gets to stage 2, it's not pitting anymore. It then takes on more of a spongy consistency and the arm becomes completely engorged with fluid. And at this point, although it's manageable, it may not be reversible. So let's not even let that happen. And that being said, we're going to start with exercises to help basically increase your lymph drainage and prevent lymphedema. So let me go ahead and get you on your back here, Leanie, with your head down here. Now, just a quick education on the lymphatic system, and this is very layman's terms. You're going to divide your body into quadrants. So the first, your neck, everything drains upward. You can look at me, you can relax. From the neck up, so for example, I had thyroid cancer. If I had lymph nodes removed here, I'd be at risk for swelling in the neck upward. Well, the arms are kind of the middle quadrant, and one is completely separate from the other. So if you've had lymph nodes removed in your left side, you're only at risk for lymphedema on the left side. It's not going to travel over to the right side. And then there are people who have lymph nodes removed in their lower extremity, which of course, you're not one of them. And then they're at risk for lower extremity lymphedema, which we cover in another video. Okay? So our focus, of course, is going to be to open up the lymphatic pathways in the upper body. So why am I starting you off on the floor? Well, you have a pooling of lymphatic fluid in your torso. So the first thing we need to do is we need to get any of the lymphatic fluid that's accumulated in here circulating through your body so that when we then do the lymph drainage exercises for your arms, it has a place to go. All right. Now, Leanie, you've had a couple accidents. Your back is a little high risk, so I want you to be aware. And for any of you at home that are doing this, if you have back problems, if anything hurts you when you're doing it, then stop. Reevaluate, maybe try a different positioning, and ultimately, if any of these exercises cause you pain, then don't do them. You don't have to do every single thing. We're going to begin with a modified sit-up or a crunch. So the days of old-fashioned crunches or sit-ups sitting all the way up are long gone. All we need to do is contract your abdominal muscles. Now, if somebody has had an abdominal tram, which of course you have not, then this isn't the ideal exercise. As I said in the first part of this video, you don't really have a purpose to do crunches. But for lymph drainage, you can go ahead and do crunches even if you've had an abdominal tram. If you've had two sides of the rectus abdominis used, so you've had a bilateral abdominal tram, you will not be able to do crunches. You will physically not be able to do crunches, so you'll just skip that part and move right on to the pelvic tilts. So let's begin with your hands behind your head, chin up to the ceiling. Imagine that you have a grapefruit right here, so you can't tuck your chin to your chest, and you have a string pulling your chin up to the ceiling. I want you to exhale and raise up off of the floor while you think about pulling your belly button toward the floor. Inhale as you go back, and then right back up. Now you're going to do as many of these as you can comfortably. My goal is going to be 10, but if you can't do 10, or you at home can't do 10, do what you can do. Exhale up, pull that belly button towards the spine so you're tightening up these muscles. You're doing a great job of keeping your neck and chin, everything upward and in neutral. Good. Let's try 3 more. Perfect. All right. And last one. Great. Relax for a second. Go ahead and put your arms by your side. Now this next part is the pelvic tilt. So everybody can do pelvic tilts regardless of if you've had an abdominal tram or not. Really simple. You're pressing the small of your back toward the floor. Again, drawing your belly button towards the spine, but in this case you are actually tilting your hips. So let's try 10 of those, okay? So pressing down, just hold it for about a second. Inhale as you release, exhale as you contract. And I don't know if you can see by the video that her hips are actually tilting. She's rocking her hips. So from the side, it's as if I were tucking my hips underneath. So go ahead and do the last few. And this just warms you up a little bit. Is this our last one? And relax. All right, hard part's over. Now we're going to go ahead and stand up. So let's get up on our feet. And so we've basically emptied out all that lymphatic fluid that may have been accumulating in here, and we're ready now to begin draining it from the upper body so it can start circulating. Ready? Take a nice deep breath. All right, let's begin. Just have your arms out to the side like so. Now, for you at home, or if this begins to cause your arms to ache or pain, you get tingly and numbness, then just shake it out and do what you can do. All right, but from here, all I want you to do is palm up, palm down, just breathe. Make sure you're not arching your back. You can even put one foot forward if you'd like. Okay? Good. All right, and let's just go with 10 since that's what we've been doing. At home, if you can only do